National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Dr. Jonathan Beatty here, naturopathic doctor and a health expert at Nationalnutrition.ca. Today I want to talk about a very difficult to diagnose syndrome called chronic fatigue syndrome. It often gets overlooked by a lot of doctors just because their patients don't bring it up or don't bring it up correctly with the physician. So what chronic fatigue syndrome is, it's essentially exactly what it sounds like. If you suffer from day-to-day debilitating levels of fatigue, you may have chronic fatigue syndrome. That being said, it's not the most helpful of diagnoses. The reason behind this is that a syndrome is literally just a collection of symptoms. A syndrome is not a proper diagnosis or a true or complete diagnosis. A complete diagnosis has a cause. So what we're going to do today is we're going to try and cover a few of the major causes as to why you may suffer with the symptoms of chronic fatigue syndrome. So if you struggle to get out of bed, if you are easily short of breath, if you have excessive levels of weakness, that's chronic fatigue syndrome. Oftentimes, if you get that combined with pain at certain places on the body, they're called trigger points, you'll actually morph from a diagnosis of chronic fatigue syndrome into fibromyalgia. They're very similar conditions. Now, to me, none of these are a true diagnosis. I look at it as chronic fatigue syndrome can have, one or many causes, and so it's important to try and evaluate all the various causes of your condition. Some of the more common ones, there are certain genetic metabolic conditions whereby your body has difficulty activating required nutrients. So if you struggle to activate your B12, well, B12 is involved in the development of energy, and if you have certain genetic imbalances whereby you cannot activate your B12, that in and of itself can lead to the development of chronic fatigue syndrome. And it's not necessarily because of a lack of B12 intake, it's a lack of B12 activation. And so for people that have that condition, they need to take very specific and usually injections of B12 in the active form to combat the body's inability to activate it. Other things I've seen related to chronic fatigue: food sensitivities, food allergies. If you're taking in a food that is chronically activating your immune system, that's going to take a lot of energy to manage. People don't realize just how much energy the immune system uses. To put it in perspective, I'm going to throw out some numbers for protein. The average person needs about 1 gram of protein per kilogram of body weight. You get into high-end athletes, you might need 1.5 grams of protein per kilogram of body weight. Typically, bodybuilders will take about 2 grams of protein per kilogram of body weight. Now, if you have a serious infection, major trauma to the tissue, your body can actually require 2.5 grams of protein per kilogram of body weight. Putting that in perspective, you have even higher nutrient requirements than a professional bodybuilder at a time when your immune system is being called on in a large way. So if your immune system is being called on, not necessarily in like a single large demand, but you have a constant never-ending demand because of the constant intake of a food allergen or something that your body is sensitive to and creates an immune response to, that's slowly going to be a detrimental to your body's energy reserves. Your body's constantly going to be using up energy trying to manage its immune system, and over time that's going to lead to a chronic fatigue syndrome or a state of chronic fatigue. Other things, basic nutrient deficiencies. I already alluded to low B12 being related to chronic fatigue. Low iron can actually cause chronic fatigue. I've actually seen some patients where they've come into my office diagnosed with chronic fatigue syndrome, and in actuality, all they really had was an iron deficiency anemia. And simple supplementation with iron resolved years of fatigue. And some simple diagnostic blood work can determine if you are low in iron. So you want to make sure that you rule out all the common causes, and most of them have to do with nutrient deficiencies. Some nutrients that are very important for managing your body's energy: creatine. Vegetarians and vegans, I highly recommend that you take creatine. Creatine is only found in the human diet. in animal flesh. And if you choose not to eat that, that's fine, but you will need to supplement with creatine, and there are vegan versions of that available on the market. But creatine is needed by every cell in the body to produce energy. And so if you have a creatine deficiency, your body is going to fail at producing adequate energy. Now, the human body can produce some creatine, but it typically cannot produce enough for your daily needs if you don't have any dietary sources. And this is why creatine is actually a required nutrient for vegetarians and vegans. So ensuring that, again, you take in adequate nutrients for your body's metabolic requirements. You need to be able to produce that energy. Another one I usually like for people with chronic fatigue is Coenzyme Q10. If I can take you back to grade 9, grade 10 science, where you learn about Krebs cycle and the electron transport chain, one of the key cofactors that we learn about in science in all cells in the human body, in order to produce energy, they need this nutrient called coenzyme Q10. And some people, they don't have adequate levels of it in their body. By supplementing with CoQ10, you can optimize the cell's ability to produce energy. And of course, what is fatigue? It's a lack of energy. So if you don't have adequate energy, consider creatine and CoQ10, maybe some iron and B12 to ensure nutrient adequacy for proper energy production. So proper energy production, really important, easy ways to manage your chronic fatigue syndrome. So those are some of the things you can do to naturally control your symptoms of chronic fatigue syndrome. I do recommend go and get, evaluated and try and figure out the cause of your specific, or the causes of your specific case of chronic fatigue syndrome. Check out more of our natural health videos, subscribe, and if you have any questions or comments, feel free to post them below. And always remember, knowledge is health.